So if you or someone you know has been diagnosed with skin cancer, you may have heard of Mohs surgery. You may have many questions. What is Mohs surgery? Why is it recommended? Why is it the gold standard for treating skin cancers? So that's what I'm going to talk about today. I'll tell you a little bit about the history of Mohs surgery, how it works, what to expect, and why I think it's such a great tool that we have here to treat skin cancers. So Mohs surgery is actually named after Dr. Frederic Mohs, who's a surgeon who developed this technique back in the 1930s at the University of Wisconsin. He is infamous. He'll talk about Mohs surgery today. He developed a technique to both excise skin cancers and use the microscope to guide us to get all the cancer cells removed and sparing the normal healthy tissue. Because of this specialized technique, it really is the gold standard for treating skin cancers, and we can get higher cure rates than any other cancer treatments that we have available. Particularly, we use Mohs surgery in areas that are more high risk for either recurrence or just more cosmetically sensitive areas where we want to minimize the defect size so we can get the best cosmetic results. So this especially around the eyes, the nose, lips, ears, scalps. They're common areas that we treat with Mohs surgery. So Mohs surgery is the most effective treatment for skin cancers. For certain types of skin cancers, we can get cure rates up to 99%. So that's probably one of the highest cure rates you can get for cancer treatments out there. And because we're able to microscopically evaluate the tissue and make sure all the cancer cells are removed and evaluate 100% of the margin, that is the way that we're able to get such high cure rates and really, give the assurance to our patient that their cancer is gone. So what to expect with Mohs surgery? So Mohs surgery is an outpatient procedure, so it's done here in the office. We use local numbing anesthetic to do the procedure. Really taking the what we call the layers or the stages is pretty quick, but there's some waiting time while the tissue is processed in the lab. But we go stage by stage or layer by layer until all of the cancer cells are removed. Then we go to the next stage, which is the reconstruction or repair. Sometimes that's very simple, some stitches in the wound. Sometimes it's more complex, so I may do more advanced things like flaps or grafts. But it's all customized to give you the best results to preserve your normal anatomy and function and keep you looking beautiful. So on the day of surgery, I usually recommend just planning to be here for several hours. Sometimes it's less, sometimes it's more, usually about a half a day. In between the stages, oftentimes patients just stay in the room, or we have a separate Mohs waiting area where they can relax, have some water, some coffee, watch some TV. So we try to make it really comfortable. Then usually after the surgery, if we need to have you come back for some suture removals or some post-op checks, maybe coming back in a week or two for visits. Sometimes we'll put dissolving sutures in. We don't need to see you back except for your routine skin checks. Thank you for watching and learning more about Mohs surgery. As you can see, skin cancer detection and early treatment is very important. So to continue to learn more about skin, make sure to subscribe to our channel.